We're getting ready to talk to a really wonderful guest today about something serious, a very serious subject, in fact, because it will affect all of us at some point in our lives. We're talking to Dr. Niki Barr, who has written a book called Emotional Wellness. That is the other half of treating cancer. And we're talking from having cancer to caring for people who have cancer. How do we even begin to heal not only physically but emotionally from this?
Well, I think, Susie, you bring up a really good point. It is all-encompassing. It includes everybody. It's a family issue. It's not just the cancer patient. It's everyone that is involved. Mm-hmm. And so we need to look at the emotions of everyone, because it's not, you can't treat it separately. And we have put so much emphasis on the medical aspect. And now we're all seeing, including the medical teams, are seeing that the emotions are very important to pay attention to.
What's the biggest impact on other family members when someone has cancer?
It's the emotional shock, I think. That's the first thing that happens, is just such a huge shock. And then it's the day-to-day, because your life isn't predictable anymore. You know, we kind of get up.
Your life is not your life anymore.
That's right.
Really.
That's right. Everything is thrown into chaos.
And so you start out with a loving, emotional, want to give, want to help, and then as you see your life kind of slipping away and going to the person that you're caring for, there can come a resentment. Then you struggle with the guilt. And so it is so deep-seated.
That's right. That's right. All throughout cancer, you've got something, whether you're dealing with diagnosis, even when you're, you know, they say, hey, we don't want to see you for another 6 months, and you're done here.
Right.
You're still got a lot of emotional things going on.
So what do we do emotionally? I know I had breast cancer, and my husband had colon cancer, and we took the humor route.
Yes.
But we were also, I mean, Tom just had it. He's 79. I had breast cancer at 65. So we knew we were going to get something.
Right.
It's not like, you know, we thought we were going to go on forever without it. So we just said, okay, how are we going to play the role? Are we going to be whiny, moany, fearful? Or are we going to live it up and be an inspiration? There are choices, aren't there?
There are definitely choices. Yes, yes. And I wrote the book having a practice that was totally focused on cancer patients and their families to give tools that one could use to get through cancer, to navigate. And they're simple tools. Humor is certainly in there. Zoom in, zoom out, where you're looking at, how do I feel right this minute? And what can I do? Would I like a cup of soup? Would I like to look outside, take a little walk? You know, what kinds of things? Zoom out. How are things going in the big picture, so to speak? Kind of like a camera works. Or what if thinking? You know, you can't win what if thinking. What if I die? What if my family?
You have to face that, though. You have to face that fear. You have to go to the end of that.
Absolutely.
And then that kind of makes the fear not so scary, because you decide what you are going to do. We're all facing the end.
Yes,
you know?
We're all going to die.
It's not going to be a big shock.
Let's talk a little bit about caregivers and the needs that they have, and sometimes the needs that are ignored.
Yes. Caregivers, thankfully, because sadly, so many people have cancer, but we are starting to pay more and more attention to caregivers, because that's they've got a double whammy going on.
They really do.
And that's huge, and we need to have resources for caregivers. Support groups, they're becoming more and more popular, but it's sometimes difficult for caregivers, because they're like, well, I'm supposed to show up at Thursday at 12 o'clock. I can't do that. That's right in the middle of. So it's.
But there are online.
Definitely, and
support groups.
That's exactly right. There are online support groups that can help with that. Individual counseling can help with that. Getting together with people. You know, I've had patients that their caregivers have gotten together in the waiting room while they're.
And I think, too, the caregiver has to make sure that every week they're doing something fun for themselves.
Absolutely.
They'll be rotten to the other person.
Absolutely. I actually push every day.
Every day.
Every day.
That's good for any of us.
Every day.
Taking care of ourselves and loving ourselves and having a good day and doing the thing that makes us feel good about ourselves.
That's right.
Get more advice and information from Dr. Barr by going to canceremotionalwellbeing.com.